Welcome to the Dip-In Steering Committee orientation and other materials. Again, here are some of our steering committee members, and this section will cover what is diabetes. And I want to start just by remembering sort of why we're doing the project. And what we're looking at improving the quality of those living with diabetes. We're trying to identify those that are at high risk or have pre-diabetes and don't know about it. And we're trying to foster an environment within both the physical and social environment that will help support health and well-being for all residents. So diabetes is a long-lasting condition that affects how our body uses food for energy. When, our food is broken down into sugars, also called glucose, and these are released into our bloodstream. When our blood sugar goes up, our pancreas releases insulin, and that allows the blood sugar then to be taken up into the cells so the cells can use it for energy for the work that they're doing. If you can't make enough insulin or your body doesn't use the insulin that it does make, your blood sugar stays in your blood and can cause some serious health issues. For example, heart disease, loss of vision, it can affect your kidney, and it can lead to lower limb amputation. Just a little bit of looking at who is diabetic. We have about 34.2 million adults in the US that have diabetes, and 1 in 5 don't know that they have it. Diabetes is the 7th leading cause of death. It's the #1 cause of kidney failure and lower limb amputations for adults, and also #1 cause for adult blindness. In the last 20 years, the number of people that have been diagnosed with diabetes has more than doubled. And we know that we have, or we estimate that we have about 88 million additional people that are pre-diabetic. And again, 1 in 3 people don't know that they are pre-diabetic. In Indiana, about 12.5% of adults have been diagnosed with diabetes, and within our specific neighborhoods, that can reach up to 20%. There are several different types of diabetes. Type 1 is caused by an autoimmune reaction within the body, which causes the pancreas to stop making insulin. Type 1 cases are about 5 to 10% of diabetics. This comes on very quickly and frequently starts in children, teens, and young adults. Those that have type 1 diabetes must take insulin every day. There is no prevention or cure known for type 1 diabetes. In type 2 diabetes, your body doesn't have enough insulin or isn't able to use the insulin that it has to control the blood sugar. Again, about 90 to 95% of diabetics have type 2 diabetes. These symptoms can come on more slowly, and type 2 can be prevented or even delayed if people improve their lifestyle changes, for instance, increasing their physical activity, changing how they're eating, losing weight. And then we have the third type, which is gestational diabetes. This develops in pregnant women that haven't had diabetes before. It frequently goes away after the baby is born, but both the mother and the baby remain at higher risk to develop type 2 diabetes later in life. So what are some of those risk factors for diabetes? I mentioned that one of the ways to prevent it is to lose weight. And obesity is the single most important risk factor for type 2 diabetes. Smoking and alcohol use can also increase your risk of becoming diabetic. Lack of physical activity. Your age is a risk factor. Again, type 2 increases in people as we get older. Having a family history of diabetes is one of the risk factors. Again, pregnancy with that diagnosis of gestational diabetes. So pregnancy can be a risk factor. Those women that have polycystic ovary syndrome can be at risk for diabetes. And there's also racial and ethnic risk factors. So for instance, African Americans, Native Americans, Alaskan Americans have higher incidence of diabetes. So again, looking at what we can do about those risk factors, our diet and the food intake makes a difference. If we're taking in extra calories and fat, that can cause our blood glucose levels to go higher. Weight loss can decrease that the risk of, because we're managing our food intake, so it decreases the risk of becoming a pre-diabetic. It also allows the diabetic to have better control of their blood sugars. If you regularly eat a diet that's high in fat, calories, and cholesterol, all those things will increase your risk of diabetes. If you tend to have a diet that's got low fat, low cholesterol, low salt, low sugar, that would decrease your risk, but you also want to watch the portions or the amount of foods that you eat in each of those lower risk categories. So just to go again into some of the foods to watch for, foods that are high in cholesterol, ones that we want to avoid. So you can see pictures here of red meats, butter, egg yolks, ice cream, cream cheese, French fries, fried chicken, muffins, and other commercially baked goods. All of these have high cholesterol, so you would want to limit your intake and not have them too often. Again, other high cholesterol foods to avoid: canola oil and other processed vegetable oils, potato chips and packaged foods, cookies or other sugary treats like donuts, bacon and processed meats, alcohol, whole milk, skim milk would be preferred, and refined grain products. So foods that you would want to include in your diet, which would be high in fiber, would be fruits and vegetables, beans, legumes, whole grain breads and grains, and nuts. And to watch for their sugar intake, you can look at on your labels of your items for other names of sugars. So if you see high fructose corn syrup listed, or cane sugar or cane juice, maltose, dextrose, invert sugar, rice syrup, molasses, or caramel, all those are indications of potentially higher levels of sugar in your foods. So again, one of the ways that you can decrease your risk of diabetes or help maintain your blood sugars if you are diabetic is to look at your physical activity. Physical activity causes our muscles to take up glucose 20 times faster, and so it helps lower our blood sugar levels. It helps us decrease body fat, blood pressure, and cholesterol. People that have type 2 diabetes that exercise, so this would be aerobic or resistance or some kind of combination, have seen a decline in their blood sugar levels. And then one study showed that if they participated in a 12-week program of having that regular level of exercise, they did have a significant decrease in their blood sugar levels. Normally adults need about 150 minutes of exercise a week. And those that have followed that type of level of activity saw a 3 times reduction in their A1C level, which is a measure of your blood sugar average over the previous 3-month period of time. Exercise doesn't have to be high impact. We're not asking you to go out and run or play basketball, but walking, and I'll have some other examples in just a minute. Any activity that we do helps. And exercise can be cumulative over the day, so you don't have to go and spend 30 or 40 minutes at a time. You can do 10 minutes short walks 3 times a day, and that adding those up will get you to your 30 minutes over the day. So again, some other good ways to increase activity: trying to walk 30 minutes 5 times a day. But if you haven't been walking, start with trying to get out 10 minutes a day. And then after the first week, see if you can increase it to 15 minutes a day. Gradually get up to that 30 minutes a day. Biking is great. Again, a moderate pace. It doesn't have to be at a really high pace. Swimming, doing water aerobics or laps. Again, start at swimming for a few minutes, maybe a few laps, gradually increase that over time. Getting out and gardening, dancing, playing catch, walking your dog. All of those things are great ways to get physical activity in your day. And then stress is another risk factor for diabetes. And stress is when you're feeling threatened. It demands your body, forces it to go into a fight or flight response. And this causes extra hormones to be developed. And those then send more blood sugar to your muscles and limbs, so you're ready to do that flight or fight. And stress can affect people differently. The types of stress that people experience can impact their physical response and their ability to control their blood sugar. Some symptoms of stress to think about: do you have headaches, muscle pain, or tension? Are you sleeping a lot more or a lot less? Are you getting a sense of just not feeling well, fatigued, feeling unmotivated or irritable, depressed, restless, anxious? All of those symptoms can indicate that you're under stress. And stress impacts diabetes because, again, that hormone is produced and it causes the high blood sugar levels to occur. People with diabetes can't convert that glucose into energy, so it builds up in their blood. And if people are under constant stress for long periods of time, it makes managing their diabetes very difficult. People with type 2 diabetes that have a lot of mental stress can frequently see an increase in their blood glucose levels. Sometimes with people with type 1 diabetes can have more of a varied response. For some people, it makes their blood sugar increase, and for some people, it makes their blood sugar decrease. But if you have physical stress on top of the mental stress, it will frequently increase your blood sugar for both types. Stress can also activate our fat cells, which can contribute to a condition called insulin resistance, when our body isn't able to use the insulin effectively to use the glucose for energy. Stress can impact our sleep and can impact our blood pressure. So in conclusion, what can we do to prevent diabetes? We can increase our physical activity. We can improve our nutrition and decrease our stress. We can work to improve the physical environment in which we can do those activities, so that we can go outside and be active and have access to healthy foods within our environment. And we can make these changes through policies, systems, and our environment, which we'll talk about in one of our next upcoming presentation. This is the end of this session, and if you have any additional questions, please contact one of our Dip In Project team members. Thank you.